Some doctors think that people are too aware of their bodies and they get overwrought and over anxious, and it creates all sorts of illnesses and diseases that might be fictitious. Other doctors, though, think that you should know your body quite well so that you can pick up problems as early as possible. Casey Barras went out to find out how well people think they know their bodies.
Girls, do you know what your cholesterol level is?
No.
No, I'm not really sure what it is.
I know exactly what it is. It's 3.8.
That's pretty good.
Oh yeah, I was thrilled with that.
Cholesterol, I think, is about 6.
Do you know what your cholesterol is?
Yes, I do.
What is it?
It's 3.7, I think.
It's pretty good. What about your resting pulse?
Well, that's something I've never thought about. Pulse, well, as long as my heart's beating, I think that's the main thing.
So Casey, it was a bit of a mixed bag.
Yeah, it sure was.
And Karen, you've been investigating, because this is quite important if you've got a chronic illness.
Yes, it's definitely a benefit in people being able to monitor their own bodies and seeing how their bodies are changing. So I went and spoke to an expert about how you actually do monitor your own body.
When the patient is living in the outside world, they have to take care of themselves. And the challenge is, how do you help people manage themselves? And why don't they do what we tell them? Which is really the question that we have to ask.
You mean that patients stop feeling unwell, so they stop taking their medication or they return to bad lifestyle habits?
Exactly.
So if you're talking about people with chronic illness, how do you get them to listen to their own bodies?
I say to them, I have to show you what your body is like. I want you to take your blood pressure at a particular schedule. When you first get up in the morning, which is when it is highest physiologically, 2 hours after you take a medication, and then in the evening, and just, I want to see that diary with you. And there's an opportunity to compare a timed diary with a timed blood pressure tracing. And when I show it to them and I say, now, this is your body, you know, talking to us, your pressure's really been pretty high over the past 24 hours. And you don't have anything in this diary that in any way corresponds to anything here. People say, I don't believe it. I said, it's your body, you know, I didn't make it off. We just took it off you, and here is the tracing. That's very telling. How you help them frame what's going on in their own bodies is what's critical.
So we don't know enough about our bodies, and those terrible patients not following doctors' orders.
Yeah, well, there's a whole lot of reasons why patients might not follow doctors' orders. The real issue here is that we should be monitoring our bodies. But Norman, what is it that people should be looking for?
Well, Karen, this really depends on your situation and your age. So if you are, for example, over the age of 40 or 45, you really should know your cholesterol. You should know what your blood pressure is. Everybody should know what their waist circumference is so they can get it down. That's a really significant risk factor for heart disease and for diabetes.
So if somebody has a chronic illness, is this a conversation they should be having with their doctor to get the doctor to tell them what factors for each chronic illness they should actually be watching?
There's a huge controversy over this. So the question is, if you've got a high cholesterol and you're on treatment, how often should you have it tested? And some people argue it's only maybe every 6 months or every year.
I guess it depends, though, on how serious your chronic illness is. So if you are somebody that is really seriously ill, you probably need some more regular monitoring.
That's absolutely right. So if you've got diabetes and you're on insulin, you've got to check your blood sugar all the time. But if you've got adult onset diabetes and you're not yet on insulin and you're on diet or maybe medications, there's a lot of argument about whether or not you measure your blood sugar on a regular basis.
And there must be a role there also then for people keeping a diary, so to be able to record what they're eating and then understand how what they're eating affects their own body.
There is a role for diary, but there's also a role for diary, for example, if you've got really bad asthma and you're measuring your lung function so that you can detect when it's deteriorating fast.